Ya estamos en línea. So, hi. So, hello everyone. I want to this case with you. This is a female with 92 years old woman came in because of two things. So, abdominal pain and at the same time fever, some clinical signs of cholangitis. So she came because of migration of a stone. But when we were doing our US abdominal ultrasound, we find out that there is inflammation of the gallbladder also. So that's why it's more than the inflammation of the gallbladder than than I will measure here. You see, this is the wall of the gallbladder. This is 4 millimeters. So it's not hypoechogenic; it's hyperechogenic. It means so it's there is inflammation, and at the same time, when you see the DFI, you see a lot of microvascularization. Normally, you have a microvascularization, but not increase it. So I believe I believe it's also there is there is a gallbladder inflammation, and I believe this patient is not a surgical candidate more. So what I will do now is first I will make a drainage of the gallbladder. Yeah. So trans mural. Why? Because I prefer to do it in this way, right? I want to. I don't want to take too much time on her because of her comorbidities. She have diabetes. She have so we can see here. Yeah, some infection. Yes, some pus, a small pus. You see? Okay, so this is not normal. I will put flush. I will put contrast right now. Why I am using this technique? Because I will not use an Axios today. I will use a plastic stent because I believe it's much better. So for her, will be much better. Look the gallbladder of her. It's so big, so big. You see? It pulls and slash. So I want to let's just a plastic stent today, and then to remove it. And I will make an ERCP now. So okay, I want more contrast. So you see, it's big, huh? That's why it's the pain. I believe it's more the pain because of the so dilated gallbladder. It's the first time that I see it so big. You can see on the X-ray. Okay, now dame la guía. And I will use a double pigtail. ¿Qué tenemos? This is it. Sí, perfecto. So I will use a pigtail, double pigtail, 7 French by 5 centimeters. Will be okay. And I am transdudenal. It means so it's more fixed, so we don't have the risk of the stomach. You see here? Oh my God, it's big. Okay, so now empujo. So you can do it just by how to explain? Just by US, yes. We can use an Axios, yes, but I believe because of the age, it's better one plastic stent than an Axios first. So we need. She will relieve when we relieve the biliary tract also, and the cholecystitis I believe will be solved easier. So it's more pus because of the destruction, and it's more because of the bacterial infection more than because of the stones. So I don't see a lot of stones in the gallbladder right now. It's more because of the pus and all these things. So I think with the drainage and medication we'll be fine. So now I will use the cystosome, right? So now I will connect. So now I am okay, empuja. And I will pass my stent. You say the pulse is coming. Look, necesito una imagen endoscópica. You see, the pulse is coming. Okay, so the problem of the patient, it was not just the stone migration, it was the cholecystitis. It was not detected. But at the same time, because of the comorbidities of the patient, for sure she will not be going to surgery. I'm trying to keep my position. This is very important. I'm not arriving to pass. So what I will do now, okay, necesito retirar el stent. So I will remove the stent first. So here's my, oh, it's transgastric. That's why. I'm not. Perfect. Ah, I'm inside. So now we are inside. Now, no, it's transduodenal, yes. So now I am inside. You can see that's why the X-ray was okay. So I need that you deliver it the first part there. Okay, you will deliver it. Libera. Espérate, tengo un segundo. Okay, libera. Yes. So the first part is inside. You can see there very well. I will try to see by the US. And then I will put the second part, I will deliver it. Okay, libérala. Trying to. Okay, now, you see? So perfect. So the drainage is good. Drainage is good. It's perfect. So it's coming the pus, you see? Look. It's coming the pus. It's very good. So now, it will create the fistula and it is more, how to say, it will make less damage in the tissue as the metallic stem, for example. So it's good. Okay, so now I will change. I will use the ERCP, right? But I will try today to use a new, well, no, it's not new. It's new for us, right? To be honest, it's new for us. It's a new sphincterotom. Well, it's not a new sphincterotom. Tráeme una bolsa de, que me pase una bolsa de, Brian, dame el duodenoscopio. So, I will use today a new sphincterotom. For me, it's a new one, so it's not new one. It was is how to say? Well, my good friend Derek from Fujifilm Latam wanted that I try it, and I really was impressive by this sphincterotom. I like it. I like it because of many things. I think it's uh, interesting the concept. So the tip of the sphincterotom is the tip of the sphincterotom is 4.4 French. Quiero el esfinterótomo que está ahí. So this is no, esa es la guía. Solo este es el único que hay, so yeah. So this is yeah. Is this one? Yes. ¿Cuál? No, eso no es. ¿Qué más? Okay, I will use the balloon from them. Okay. Okay, so I will use today one balloon from Fujifilm. It's my first time. This is I will make a champagne today, but I want to talk about this one. Uh-huh. So this is a new. Well, no, it's new. It's from Network Fujifilm. So this is a triple lumen, the AXS Tom Plus. So one of the characteristic of this one, at least that is what my friend Derek said, is that this is 4.4 millimeter or something like that in the tip, which make easier the access. That mess. So I will try today. See, I will try today, Derek. Thank you. I will give my feedback now, live. So you see, we can see very well. My plastic stand. Okay. Let's see. Okay, so the papilla is here. And I will use this. Yeah, the tip is very tiny, huh? Here. So the tip is really small. So in theory, with this papilla, we need to see if it is really an amazing sphincteroton. So you can see it's small, really a small or teeny tip. So it makes, in theory, can help you in the cannulation, right? In an easier way. Empuja la guía. Okay, empuja la guía. Ten ahí. So it's not so teeny, huh? It's okay. It's not bad. At least the angulation is okay. So I'm talking about the characteristic of the tom, of the filter tom that I am proving now. And if have another, yeah, have an advantage, huh? Look, I am almost inside. Inyecta. Empújala ya. We are inside, you see? Oh my god. It's the fastest RCP that I did in my life. It's not true. But it's very good. It's very good. Derek, it's very good. I like it. So now I will inject. So you see, en grande quiero ver la CEPRE y la endoscopía en pequeño. You see, the stone is there. So now we need to remove it, and I will use, for my first time in the life, this MedWork Fuji, but it's good. I like it. To be honest, it's very good. Is I believe for papilla like this one, a small one is amazing, and also if you want to make faster cannulations, probably can have some advantage. We need to make a study, even if it's just a sphincterotomy, but these small things, this small kind of uh, change can change a lot of things in the field of endoscopic, surgeries, or ERCPs or whatever. So maybe the time of cannulation could be less. I don't know if it's expertise or everything, but also it changed the position. It's super nice because it changed the position. Here, the tip. You see? I'm sorry. You see? Up, 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 up. But well, we are not working on this today. We're working on remove the stone. ¿Cuánto es el diámetro de este balón? It's from 50 to 20. Oh wow. So this is a big balloon, huh? So we need a 15, yes. Yeah, 15. So we have 15, 18, and 20, right? So wow, it's good. I like it. So Derek is good. It make it easier to make the ERCP. You see it? The papilla was not easier, huh? So it went smooth, easier. So thank you and congratulations. It's a good product. So this is the first time because I believe the rep in Ecuador they didn't want to show me, huh? Maybe. I didn't knew that you have this kind of devices also. Huh? Then. So the balloon is okay. Little. I feel it a little hard to my own, how to say, preference. Okay, let's go to inject primero. Injecta. Okay, now inflate the balloon. So she inflate the balloon. Now I want to say I want to inject there, inject that. I want to see the cystic duct. Se pinta. Okay, now you see. Okay, perfect. Okay, that is a very good picture. Okay, now, okay, I will remove this. You see, the stone is coming. Oh, the stone is out. Okay, it's here. You see? So if that big stone passed through, because it appears it was first there inside. I want to try to see. Tenemos. Okay, 10. Okay, infla. Okay, retira. Okay, empuja la guía. Dame el esfinterótomo. So I will try to see. I will try to work a little bit more on her gallbladder. Huh? I don't have the drainage that I wanted. Well, I will use now the 4.4, right? Sphincterosome, because I want to go through. Empuja la guía. No, retira un poquito. Retira, retira, empuja. No, inyecta. Empuja ahí. No. So it's not easy, huh? Ok, inyecta no. Inyecta. Sigue. Sigue. No, 10 ahí. 10. 10. No, 10. ¿Me puedes hacer zoom sobre esa área? So now I am using zoom because I want to see if I can go. ¿Tienes el colangioscopio de 7 French? ¿Tienes? Okay, no. So I will try to use a 7 French cholangioscope. I want to see my gallbladder and maybe make some aspiration from direct visualization. Okay, so the future is evaluation from inside, I believe. Huh? So we new cholangioscope like this one that I showed yesterday. So maybe we can make a lot of things, very interesting things. So Now, if I can pass through the cystic duct, that is a little difficult, but it's better under direct visualization, right? It's really much better. Ahí está. Okay. Sácale el zoom. Okay. No, quiero agua. Quiero agua. Agua, aquí en la casa. Okay, so, good. Okay, pasa. Okay, dale. So, yesterday I showed a little bit what can we do with this kind of cholangioscope. So I want to see if I can go inside the gallbladder, maybe make an aspiration directly, and then try to perform it to put another catheter inside. So now we are again. So, so I have my cholangioscope inside. So now you can see very well. Saca la guía. And now we are too high. So this is the okay. Ten aquí. Okay, so here. You see, here is my cystic duct. So now I want to go inside using the 7th French. Wait. Ahí, ten aquí. Ten ahí, frena. So I am advancing. Puedes empujar la guía también por aquí, ¿no? Because empuja la guía. Sigue, sigue, sigue. Momento, yo te voy a ayudar. ten aquí. So, oh well. I need to see where is my gate. Where is my main entrance? Aquí. Empújalo aquí, ¿eh? Espérate. No. Ok, empújalo aquí, ¿eh? Espacio. Floro. Floro. Ok. Ten ahí. So it's not the correct way. So I need to see where is my main entrance. I see the pus coming, but I don't see where is. En grande la colangioscopía. Dame. Quiero ver la imagen de rayos X también. So wait. Okay, dame contraste. I am there, but I'm not so sure if I am inside or not. Maybe yes. Maybe not. Se empuja. I am thinking there is a superposition. Okay, contraste. Okay, empuja la guía. Sigue, 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 sigue. No, we're out. You see, it's not easy, huh? Okay, Billy's is coming now. I want to see where is my entrance. Aquí. Okay. Ten aquí. I'm doing very slow movements. Okay, ten aquí. Ahí. So I'm doing a small maneuver because I believe it's in this direction. Uh, let's wait. It's here. 10, 10, 10, 10, 10, 10. Espérate, espérate. So I need to. So I'm trying to remove the pews. Try to see my door. Let me see. Ok, metamos contraseña. Dale. So I can see the door, but I can't go inside. Empuja. Empuja. So what I understand, I think it's empuja. Empuja la guía. Sigue, sigue empujando. Sigue empujando. Sigue empujando. Sigue, 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 sigue. Espérate. So I'm going outside again. Difficult, huh? So that's why I believe the validation of using ten again. Okay. Empuja la guía desde aquí. Empuja la guía. Sigue. Ok, ten ahí. Yo te voy a ayudar. I don't know why it does this. It's not normal. Okay, so let's see. I see the push coming, but I can see the hole. The complete the cystic duct. It's because of the puce, huh? Interesting. Ten again. Okay, vamos a la izquierda. ¿No? So I believe it's here. Ten ahí. I'm trying to move. You see, like this, right? I will try to make a small movement to the right. ahí. Ah, very short and very smooth, n- very slow movements. Again, I get lost in this cystic duct. It's very difficult. So sometimes maybe it's not easier, no? Tengo aquí. So you see, I'm not fine. It looks like I am inside. ¿Puedes cambiar la orientación del... Okay. I think it's in this way, huh? Tonight, the passion. No. Let's make a good aspiration. Empuja ahí. Ok, no, no, despacio. No, no lo saques. Ok, fíjalo. I want to see if this is the area. Yeah, I think this is the area. Yeah. So then I'm going here, and then I get lost because I can't see more. Retírale aquí, poquito. No. Okay, no pasa nada. So it's very tortuous. It's like almost to make a colonoscopy. Huh? Ahí, empuja. Yeah. So now this is the entrance. Momento. This is the moment of truth is now. I saw the epithelium from the gallbladder. Just few seconds. Oh, it's there. Ah, very tortuous. Very tortuous. So what we need to see is I'm learning, huh? I'm learning. I'm learning because this is new. Going inside the gallbladder through the cholangioscope. So I know that this is here. This helped me to see. So in theory I am almost there, huh? Let's see again. The movement are really slow. Eso. 10. Ajá. Eh, momento. So up is not. Creo que aquí se vira acá a la izquierda. Posible. Oh, this is the neck. For some reason I can't go there. So this is rear. So such gallbladder like that one is not normal. Come on. And at the same time I'm inside the cystic duct, so maybe it's something. I'm trying to suction everything. Okay, ten ahí. Ten. Ok, inyecta contraste. I think we are inside. Empuja, 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 empuja. Ahora sí. Ok, un momento. Ten. Ahora sí, ten. Un momento. Oh, cuidado, un momento. I'm not so good. Empújala ya. Solo sigue empujando. Ok, ya no tengas nada. No hagas nada. We try. No, empújala ya. Empújala. Okay. Okay, so I will pass now my sphincterotomy. Sácalo. Déjala ahí, empújala ya. Sigue empujando. Con ganas, ¿ah? Okay. So I will try to pass now my sphincterotomy to try to see if I can make a balloon dilation and go inside. This is what I will try to do now. Oh, now I see. You see? Now I see very well. This is why. It's like uh, to be honest, I believe it was how to say. It's I don't know how to say in English. ¿Puedes buscarme cómo se dice acodamiento en inglés? I'm very far, so I need to go inside. Wait, I lose my position, but now we will try to get it. Oh shit. Mm-mm. No. Okay. Dame de nuevo el esfínter, el colágeno. But now I believe I rectify. That's why I didn't see it. I can. Dame el colonoscopy. So I will pass the colonoscope once again. Yeah. Let me remove there. Want to remove there. You see, there was like a. ¿Cómo dice? Buscaste en acodamiento. Sí. It's like that's why the gallbladder was in that position. Maybe at the beginning because of the stone, but then there was a kind of. You see, now it's coming. Now it's raining. Now it's raining better. So we made the maneuver. You see, the pus is coming, right? So it's good. I think I make a maneuver, a good maneuver, to remove this, uh, like a charm, like a. Okay, now let's go again. It's not about persistence. It's about to make a good diagnosis, and it's about also to. I think it's here. Kinking. Yes, that was the word I was finding. Thank you. I was looking for. Okay, so it's almost here. Okay, it's here. You see now it's raining down. You see? Now it's raining by this way. So there was not draining. That's why I put it initially. I believe there was another stone. So we can see, try to see if there is just a kinking or there is a stone. And now that I see it that it was a kinking, so now I'm much better because I believe I changed the position of the cystic duct and the gallbladder. ¿Pasó o no pasó? Okay. Ok, empuja ahí. Ok, ten ahí. So for some reason the situation is here. It's in this point. Ten ahí. Ten ahí. Ten ahí. Okay, so here. No, it's not good. So we are doing a flexion here. Okay, so I will go again far. Then again. Okay. Ok, vamos a meter contraste. Contraste. Dale. Okay. Oh, it's there. You see? Oh, it's here. Moment. Oh, yeah, I'm here. Again, perdí mi posición. It's that. It's difficult. So the stomach of the patient is not so easy, huh? We need to go again. We're almost there. Not easy, huh? Okay. Ten ahí. Ahora. Yes, sir. The orifice is here. This is my cystic duct. Me ayudas para mantener la luz. Okay, let me see. Okay, what I will do now is to try to advance a little bit. No, es que necesito liberarlo para poder ver. ¿Ten ahí? Ten ahí. Ok, pasemos contraste. No, no quiero zoom. Segundo. Ok, dale. Okay, so yeah. this. Now I understand. The contrast is going in another way. Okay. I will rectify a little bit. Empuja la guía. Segundo. Ten ahí. Ten ahí. Ten ahí. It's not an easier case, huh? So I am inside the gallbladder again. Okay, now I will not lose my time. I will make a balloon dilation. Necesito un balón de dilatación de vía biliar. Empuja la guía. Se empuja. Why? Because I believe I can pass with this 7.5 French. I have 6 French, also 6.5 French cholangioscope, but I want to see inside what is going on. And now I pass. So now I want to make I want to pass the sphincterotome first. I will pass the sphincterotome first. And then I will pass a balloon dilation, and then I will pass my cholangioscope. I want to see inside. But now it's better because I believe it's draining from both sides, the gallbladder, but I believe was a flexure that was not easier. But it's good. It's good because we are learning how to manage and how to get inside through a cholangioscope will be much easier than using standard ERCP, right, in the future. Okay, perfect. So now, sí, está bien. Pero primero quiero un esfinterótomo, el esfinterótomo primero. So now, we will pass the sphincterotome. Because I want to be sure, this is a 4.4 French, right? Let me see how it passes, and it will depend on that. I will probably change the strategy, I don't know. But if this pass, I think not easy, huh? 10. 10. Now we get easier. You see, we are inside the gallbladder. Okay, that is good. Ahora sí, empujo la guía. Okay, so now So now I want the balloon. I will make a balloon dilation, then I will pass my cholangoscope. This will relieve the patient, for sure. There was some papers published before, many years before, about the drainage of the gallbladder through the cystic duct, but it was not easier. I tried many times, and in this kind of cases like this one was difficult. But now I believe with this technology, this new technology, probably the things will change. 10, 10, moment. So you see, so I will take the long way to try to get inside much better. Yes. Quiero ver arriba. Okay, ahí. So, vamos a dilatar ahí. So I make a balloon dilation here. Perfect. Okay, desinfla. Okay, okay, ten ahí. Un momento. Ten ahí. Alright, un momento. Okay, dilata ahí. Dilata ahí. Ahí dilata. Todo. So that was a stenosis. You see, there is a small stenosis there. Now I understand. Está todo. Okay. So now desinfla. Ahí infla. Sí, todo. Ok, desinfla. Ok. Ahora sí, dilata ahí. Todo. Okay, perfect. So now, desinfla. Empuja. Empuja la guía. And I will remove this. And I will pass my cholangoscope. I came back to the original position. But maybe I need to. I will pass my cholangoscope, but also I will try to make the long position. I believe is much better for her. So now, Espérate. Voy a. So I think in the long position. Why? 10. Espérate, déjame. Ahí. Ahí rectifiqué. Ok, un momento. Ten ahí. So now we are in the gallbladder. Congratulations. Now we are here. Ahora sí puedes sacar la guía. Saca la guía. So we are here. Remove. We are in the gallbladder. You see? Very good. It's a chronic disease, right? So, yeah, this is a chronic disease. Look, again, same pattern as yesterday. Inflammation, stones, a lot of stones here. You see? That's why. So now I will take some biopsies here, and I will less also a catheter from here. This is completely new for us, right? This kind of pattern and characteristic that we are looking at cholangioscopy, I believe that is brave. That is something that we need to explore and to understand a little bit how is the behavior of it's a lot of stones, so I believe it's much better to make a big drainage to her, not just less the stent. Okay, good. No pasa nada. Cuidado. Un momento. Ah, sácale de este. Ya, dale. Sigue, sigue. Okay, so now we are outside. I will remove a little bit my cholangioscope. So abre. ¿Abierto? Yes. So now, cierra. Okay, now we have a biopsy from inside. Chronic disease, right? It's not an acute one, huh? This is very important. I believe we need to, in the future, we need to reclassify the history of the gallbladder about acute or chronic cholecystitis. Because many patients sometimes, even if they didn't have pain, they can have abre y cierra para pasar sin. No me vas a botar, no te preocupes. Ok. So I want to change. Quiero ver si puedo cambiar la posición. Guárdala un poquito. Ok. Sácale el S. I will go deep. See, now I'm exploring the whole gallbladder. You see? Now we are fantastic. I am exploring the whole gallbladder. It's almost one stomach, huh? But you see, there is pus, there's fibrotic tissue. So, empuja, abre. Okay, toma, cierra. Okay, now we have one. Okay, abre. I'm really blind. It's a lot of slush. Cierra. Wait. No. Still. Abre. Cierra. Okay, listo. Okay, dame una guía. So I will list one stand here. 1/7 French stand. Quiero uno de 7x10. ¿Perdón? Sí. Okay, perfect. Ya empuja. So I am going outside. And now I will pass my stand. Doble pigtail. ¿Tienes de 8.5x10? Bueno, dame no, 7x10. So I will use 1/7 because the 7.5 French cholangioscope pass, which is good. Okay, so good, very good. And now ¿qué busca? Ah? So I want to know what do you think about this approach, huh? Sí, está bien. Quiero ver abajo. Noticia, ¿no? ¿Qué pasó? Un momento. Ok, perfect. Ok, listo. Libera. Libera arriba. So now I have a drainage up and drainage down also. So from the gallbladder, which is okay. So I finish. Thank you so much. I believe this patient, will relieve in this way, but we need to see how is the follow-up. I don't know if they will, you know, remove the gallbladder, but well, it's okay. Thank you again, and I hope to see you soon. Okay? Thank you, thank you, thank you. Bye bye.